Good afternoon, everyone. Today I'll be presenting on malaria. And malaria is a mosquito-borne disease that continues to be a major global health concern. So during this presentation, I'll discuss what malaria is, the organism that causes it, how it infects the body, its virulence factors, how it's transmitted and diagnosed, and then the methods used to prevent and treat it. I'm also reading my notes as well. So, malaria is a disease caused by the Plasmodium protozoan, and it's transmitted by the bite of an infected Anopheles mosquito, a female Anopheles mosquito at that. So, basically, some of the signs and symptoms of malaria, the most common ones at least, are chills, fever, vomiting, headaches. So, one characteristics that makes malaria unique is that these symptoms occur in cycles every 2 to 3 days, alternating with asymptomatic periods. So, that's why it can be difficult to catch it or to figure out what it is exactly. So the causative agent, I mentioned protozoan Plasmodium. However, there are four species of that protozoan. First, we have Plasmodium vivax, which is the most widely distributed species, and it can develop in mosquitoes at lower temperatures. It causes the most prevalent form of malaria, and it's known as the benign malaria, and it can remain dominant in the liver for months or even years. Then we have Plasmodium um, falciparum, which causes the most dangerous type of malaria, also known as malignant. Um, so, if left untreated, it eventually kills about half of its infected individuals. It infects and destroys more red blood cells than other species, and it has the highest mortality occurring in young children. And then we have Plasmodium ovale. So that causes a relatively benign form of malaria. It's lower in incidence and is geographically restricted. And finally, we have Plasmodium malariae, which causes, similar to the other ones, a benign form of malaria, and it is also lower in incidence and is geographically restricted. This image right here is of P. vivax, which is the most widely distributed form of malaria. So this is a cell, and this is what it looks like in the cell. Then we're going to talk about pathogenesis. So essentially, how malaria works, or how it affects someone, is that first they get a mosquito bite from the female Anopheles mosquito, and with that mosquito bites, it injects sporozoites into the bloodstreams. So the sporozoites enter the liver cells and undergo schizogeny, which produces thousands of merozytes. So those merozytes are released into the bloodstream and infect red blood cells. So when it infects the red blood cells, the parasites multiply within those cells, causing them to rupture, releasing new merozytes. And then through the release of those new merozytes and the rupture of the red blood cells, toxins are released, such as toxins that form into chills, fever, and sweating. And then the cycle continues where the new merozytes inject additional red blood cells, while some develop into gametocytes, which are taken up by another mosquito to continue the life cycle. So essentially, this is the cycle in which the pathogenetic cycle. So enters the bloodstream, the sporozoites enters the liver cell, then it is released into the bloodstream. Then this time the merozytes goes into the red blood cells, and then the red blood cells ruptures, and then another mosquito infects a human, and ingests the gamocytes, and then the mosquito's digestive tract that contains the gamocytes unites to form zygocytes. So this is the general makeup of the pathogenesis of malaria. So virulence. So P. falciparum infects and destroys more blood cells than any other form of malaria, causing severe anemia. So the infected red blood cells develop surface knobs that cause them to stick to the walls of the capillaries. And the clogged capillaries prevent infected red blood cells from reaching the spleen where phagocytic cells would normally eliminate them. So essentially the blocked capillaries reduce blood flow, leading to kidney damage, liver damage, and cerebral malaria. So this is essentially what it looks like. You see the merocytes here, the red blood cells. You can see the ring forming. Um, so this is what it looks like when it comes to uh, how it affects the red blood cells. So transmission. So it's transmitted through an infected female Anopheles mosquito, also through contaminated needles slash syringes and blood transfusions. The last two are not as common, but they're also ways of transmission, just not as seen as often as being infected by a female Anopheles mosquito. So the epidemiology, so the regions most affected are tropical Asia, Africa, and Latin America. And nearly 250 million people worldwide are affected. In terms of deaths, there are more than 600,000 deaths annually. And the most affected population are children. So half of the deaths occur in children. And the highest mortality, 90% of malaria deaths occur in Africa. Pertaining to the US, malaria was eliminated in 1949, but approximately 2,000 cases are reported annually, mostly like in travelers, so people who travel to other countries that have high malaria rates and then bring that back into the United States. So the culture and diagnosis. So there are a few ways to diagnose malaria. First, they do the blood smear, which is known as the gold standard, and it's the most common way. So basically, they will examine the blood smears for plasmodium parasites to see if they're within the red blood cells. And this typically requires a well-trained technician to make sure that there's accurate interpretation. There's also rapid diagnostic tests, which are faster than blood smears, but they tend to be more expensive, and they can be performed by a staff with minimal training, and that basically detects the malaria antigens. And then the clinical diagnosis is that essentially in a lot of places that may not have access or just have limited resources, they typically are able to diagnose based off of like the symptoms. So, fever, chills, things like that. So it's more so symptom based diagnosis. But that essentially can lead to misdiagnosis because it's easy to confuse malaria with other diseases. And then we have prevention of malaria. So there's a few prevention. There's chloroquine, which is a drug of choice for chloroquine sensitive areas. Atovaquone, most tolerated for chlorine sensitive areas. Mefloquine, it's given once weekly. It's a once weekly prophylaxis. And I guess the con of that is that it may cause neurological and psychiatric side effects. So, in terms of vaccination, the prevention is that Moscarex is recommended by the WHO, so the World Health Organization, for children 6 weeks to 17 months in sub-Saharan Africa, and this particularly targets the Plasmodium falciparum malaria. And another prevention technique is to use insecticide-treated bed nets, as well as vector control. So treatment for malaria, there is, as I mentioned, chloroquine, which is the drug of choice for patients from chloroquine-sensitive areas. Artesunate and artemether are preferred treatment options for patients from chloroquine-sensitive resistant areas. And then we also have ACT, which is artemisinin combination therapy, and it's recommended by the WHO for malaria treatment worldwide. And it basically consists of a semi-synthetic derivative of artemisinin and a longer-acting drug such as mefloquine. So it's not used for prophylaxis, and artesunate is the only artemisinin approved for use in the United States. And essentially, these are my references. Thank you for listening to my presentation. And thank you.